TD, Minister of State for Primary Care, proposing motion 50.
Delegates, good health care has always been a key issue for Labour. But in these difficult economic times, we must use resources well. We must spend them where they're most needed. To protect people's health, we must reform our health service. And achieving a fair healthcare system is one of the biggest challenges that we face in government. Now more than ever, we need social solidarity. But our existing healthcare system has individualism at its heart. Access to care is largely determined by a person's ability to pay. As Minister of State for Primary Care, I am working to achieve free GP care for all in the life of this government. We support free GP care because we believe that healthcare, like education, should be a universal right. It is widely recognised that most healthcare should be delivered locally in primary care. Yet in Ireland, we continue to have the obstacle of GP fees for the majority of people. So illness goes undetected until it is acute, and hospitals are overburdened, and it ends up costing us all more. The Programme for Government commits the parties in government to developing a universal, single-tier health service which guarantees access to medical care based on need, not on income, and to reforming our model of delivering health care so that more care is delivered in the community. We are laying the foundations for a reformed system of primary care in the following ways. We are removing fees for GP care in 4 phases. This year, claimants under the long-term illness scheme will receive free GP care. The funding has been provided. Legislation should be passed by the summer. It is happening. And after the 4 phases, everyone will have access to free GP care. We are strengthening primary care teams where GPs work with other healthcare professionals. This year, I have secured €20 million in ring-fenced funding to fill key frontline primary care posts. This allows us to recruit 300 new primary care staff, such as public health nurses, physiotherapists, OTs, speech and language therapists and social workers who are so badly needed at community level. We are developing a transparent system of resource allocation to identify the black spots and to ensure that new staff will be employed where they are most needed. We have conducted a national analysis of the need for modern primary care centres. We are developing a plan to provide these by using existing premises where we can, building new centres and prioritising areas of greatest need. This year sees the first phase of more intense treatment in primary care for people with chronic diseases, starting with diabetes. These chronic disease programmes will increase early diagnosis, prevent later complications and reduce pressure on hospitals. The first National Director for Primary Care will shortly be appointed. A primary care fund will be established to ensure that funding is protected and goes to the front line to pay for services where they are most needed. Under these reforms, delegates, we will achieve better health outcomes, a more equitable health service and better value for money. I commend the motion to conference. Thank you, delegates.